So there are multiple difficulties because the risk in people with diabetes in terms of cardiovascular risk is very different according to the stage of their condition. So to stratify the risk can be difficult, to treat them with the right medication can be difficult. And the third thing to remember is that the risk changes with time. So somebody's got very low risk at a particular time point, in 2-3 years time they may have a very high risk, and we need to change the approach completely. So it is a major challenge, it really is.
So when you have to deal also with diabetes and cardiac risk, how can you understand what are the criteria and where to give more balance, let's say? How do you keep the balance?
Yeah, I mean, you're absolutely right. That's a very good question. How do you keep the balance? I mean, in my view, the best balance is to have that communication with a cardiologist. So you have a very close working relationship with the cardiologist. And this is why we set up what we call a cardio-metabolic clinic. So we have all these super difficult patients to deal with there and give them the best possible treatment. But of course we are focusing on the very high risk, so these are all people post-myocardial infarction, but we want to extend that to other patients. But this is our start.
Okay, and of course, do you find any opportunities, as you said, that you can manage better?
Absolutely, because by increasing this communication between cardiology and diabetes, we appreciate the challenges in each specialty, and we understand how to, for instance, management becomes better, but also we know what kind of research studies we need to do for the future. So there are a lot of benefits. And the third thing, which is probably the most important, we shouldn't forget, is that the patients love it. As a patient, if they go and see diabetologists, cardiologists at one go, it's fantastic.
And a few words about the conference?
The conference has been great. I must confess, I always like coming to Greece. It's a lovely place, people are very friendly, and it's been always a very good interaction with my colleagues, so it's lovely to come here.